If you're feeling under the weather, chances are you'll reach out to a doctor to find out what's wrong to get peace of mind.
Yeah, but for those whose job it is to heal their own mental wellness, may be a personal struggle they suffer in private. In 2023, the American Medical Association found almost half of physicians reported suffering a symptom of burnout, which can include exhaustion, compassion fatigue, alcohol and drug addiction, and even thoughts of suicide. But there is hope for our frontline medical workers.
Reporter Ann Emmerich takes a deeper look at possible causes and the science that could provide a treatment.
Dr. Bill Baer wants to prevent illness, not react to it. He's practiced internal medicine for more than 30 years and says to make ends meet, doctors have to see more patients and turn them over quickly.
So when you go home at night after putting in a long day, you may still have 3 hours of documentation and paperwork and answering messages to go through. So now you start sacrificing family time and things along the lines that you would like from your own self-enjoyment.
It's a prescription for burnout, a real medical condition affecting more than half of the nation's doctors. Dr. Baer says burnout led to his decision to leave private practice.
It was missing a couple of the kids' events. And with 4 kids, I just was struggling with, time inefficiencies and, trying to prioritize my family, but unable to do so just because the job mandated just so much of my time.
He's among many doctors who say the very system we rely on to keep us healthy is harming the health of those delivering that care.
Burnout or low energy, it's a big problem in healthcare.
Dr. Bengt Arnetz practices medicine. He's also a professor at Michigan State University and a researcher on a mission to keep doctors and nurses from burning out.
If you sit with a patient, you're much less attentive. You have much harder time to remember what the patient says, and you're much less intellectually sharp. So you don't function at the top of your capacity as a provider if you burn out.
Dr. Arnetz studies biomarkers in the blood to figure out how to prevent and treat burnout.
But people have low energy, they say. So how do you measure that in the blood? So we found a new marker to look at in blood, an anti-inflammatory marker. Or we look at how active are your neurons in the brain? How much do they grow? How much do they interact? And you can measure that now.
Measurements that can help heal a sick patient and a healthcare system seeing doctors quit the profession at an alarming rate. Dr. Arnetz conducted a study at Trinity Health in Grand Rapids to find ways to improve efficiency in primary care. It resulted in a new model that has nurses doing more work in less time, giving patients 40% more access.
If you ask personnel, the number one thing they complain about is inefficiency, that they have to work around, and all that takes so much energy.
Dr. Baer took a new approach to avoid burnout. He's among 12,000 doctors across the nation offering subscription-based concierge medical care. It gives him more time with patients and his family.
I think this also gives much more satisfaction not only to the patients, but actually to us on the provider side, because we can practice medicine the way that it truly has been. And if it wasn't for that, I don't believe I would still be able to be practicing medicine today.
An article published by the Harvard Business School says some doctors spend more than half, 55% of their workday doing paperwork. It suggests AI could reduce physician burnout by eliminating administrative tasks such as completing charts and insurance matters. In Lansing, Michigan, I'm Ann Emmerich.